Hello, my name is j.brock. I'm the health science teacher here at Knox County ATC, and today I'll be teaching you how to clear the obstructed airway of an alert or conscious victim. This is my assistant, Choking Charlie. Today, he has got choked on his lunch of beans and weenies. Now, before we even start the procedure, we need to talk about a few things. First, we need to talk about what is the universal sign of choking. When a person grabs their throat, has a wild look in their eye, and usually they're very panicked and they have lots of anxiety. You can see this on their face. That is definitely the universal sign of choking. This, grabbing their throat, is the universal sign of choking. We need to ask somebody if they are truly choking, because people who are having a heart attack tend to grab here and it looks like choking because they also have the panic and the anxiety look in their face. So we need to come up to our victim and we need to very clearly get their attention and say, "Are you choking?" Now they're going to either motion their head yes or no. Now we need to determine if we have a mild airway obstruction or do we have a severe airway obstruction. The way to determine this is our patient's response. For a mild airway obstruction, the person can cough and they can talk. They may feel strangled. They may feel like they cannot breathe. But usually they do have some gasping and some wheezing. And you're going to ask them, "Are you choking? Can you cough? Can you speak?" And if he can do either of those, we have a mild airway obstruction. All we can do with our victim who has a mild airway obstruction is stand by them, monitor them, and encourage them to cough. Encourage them to use gravity. So have them bend over at the waist and bend forward and cough as hard as they can. Now, we have all seen people when someone is choking, or strangled is the correct word for a mild airway obstruction. We've seen them grab them by the arm and jerk it up, or you hit them on the back as hard as you can. That is actually the worst thing that you can do in this scenario, because when you hit them on the back or when you grab them by the arm and pull up on it, gravity just causes that obstruction, or whatever is causing the obstruction, to go further down into their respiratory system, and that is going to cause them to now have a severe airway obstruction. So that's the next thing we're going to learn. So again, we're going to come up to our victim and we're going to say, "Are you choking? Can you cough? Can you speak?" And if they can do neither of those, they have what we call a severe airway obstruction. Now, I'm sure that you can see here with Mr. Charlie, this here is his nipple line. This is right in between his rib cage, and this little body part is called the sternum. And then right below that is the umbilicus, or belly button as we usually refer to it. This is the two landmarks that we need to use to do the Heimlich maneuver, as most of us refer to it. So we're going to find these two landmarks. We're going to find the sternum and we're going to find the belly button. Once we've located those two landmarks, now we have to get into position. We're going to make a fist with our hand, with our dominant hand, and we want to make sure that we're using the flat part, and we want our thumb to the outside. So we have the flat part of our fist, and then we're going to use our non-dominant hand to wrap it around. So I'm going to locate his sternum, locate his belly button or navel. I'm going to wrap my fist around. See, I've got the flat part of my fist, and I'm more using this bony prominence to use to help me to remove with force the object that is occluding his airway. So I'm going to put that flat part of my fist right above his belly. Then I'm going to get up as close to him as possible, because I don't want to spend all of my force pulling him back to me. So I want to get him as close to me as possible, take my hand and wrap it around. Then I'm going to use gravity. I'm going to tilt him forward. And now I'm going to do what's called the J thrust. And that's when you take your hand and it's almost like you are scooping ice cream. So that's kind of the motion you want to do. If you want to think about it, that you are pulling back towards your spine, towards his spine, and up towards his nose at the same time. So I'm going to give him quick, forceful thrusts. 1, 2, and I'm going to do that until it comes out or until he passes out. Now, I got it in 2, but you may have to do 10, 15, 20, 100 thrusts. We continue those until that either comes out of his mouth or he becomes unconscious. Now, when he becomes unconscious, that's a totally different set of techniques. We do need to call 911 if someone is choked. We can always cancel that if we get it out. We can always cancel the 911. But it's better to be safe than sorry. All right, next I want to talk to you just a little bit about doing the Heimlich maneuver on yourself. Yes, we can save ourselves. So what if Mr. Choke and Charlie was all alone and he became choked? We're going to use the edge of a table or a desk, a chair, anything that we can find. And as a person, we're going to get as close to that and as low to that as possible. We're going to wrap our arms around it and we're going to pull in quickly and with as much force as we can do. That way to dislodge the object. What if Charlie was somebody bigger than me and I needed to do the Heimlich maneuver on him and could not get my arms around him? I could use this same technique and that I would do for my own, trying to relieve my own choking. So I'm going to use the table and the desk, and I'm going to put it, or desk, chair, whatever you're using, put it up close to him, and I'm going to let him grab the desk and pull it into him, and I'm going to help him on the back. I'm going to push, and as you can see, we got that to come out. So now what do you do if somebody's pregnant, or if you do not have a table or anything available to use, and someone is bigger that you cannot get their arms around them? We're going to do what's called chest thrusts. These were called abdominal J thrusts. When we're doing it here, we're called chest thrusts. So we're going to come a little higher, just above. And if this was a pregnant lady, I'm going to try to situate my hand just above the baby. Come here, right into the chest, and here, and I'm going to do the same procedure. Flat fist next to the chest, and I'm going to do inward and upward thrust until it comes out. And of course, I want to use gravity until it comes out or he passes out. And unfortunately, we cannot save everyone. So our victim has passed out today. So thank you. That was just a short little quick video on how to do the Heimlich maneuver, or clearing the airway obstruction of an alert victim.